Good evening, everyone, and welcome to our webinar this evening. My name is Dr. Julie Dale, and I am from Dental Monitoring. I'm going to introduce to you our speaker for tonight, Dr. Sohal. I met him recently myself, and he truly is a really inspirational young dentist. He was born in California and earned his BSc in biomedical science before graduating from Prague University with his dental degree in 2014. The following year, he bought his own dental practice, which is now the multi-award-winning Broadway Dental Boutique. He has a postgraduate diploma in clear aligner therapy, and he teaches at practice growth workshops. Last year, he gained a master's degree in neurolinguistic programming, and in a few weeks, he's doing his professional marketing exam. So he's a super busy guy. So thank you very much for taking the time to speak to us this evening. Amo started using dental monitoring before the first lockdown, and he really has embraced the virtual workflow in his practice. Tonight, he's going to present this amazing product, an innovation that we both agree is the future of dentistry. We hope by the end of this evening that you will share our excitement about dental monitoring. If you have any questions during the presentation, then please just pop them in the questions box that you can see at the bottom of the screen. So without further ado, over to you now, Dr. Sohal.
Thanks, Julie, for the intro. Hi, guys, everyone, for joining me today. What I'll be discussing today is how to simply implement virtual systems in your practice, whether you are a practice owner or also whether you're an associate. This can also work to really increase the way you're treating your own patients as well. And I'm mainly gonna be talking around the sides of why I've implemented such virtual systems. It's mainly for the intention and the purpose to provide safer and more effective and more convenient treatment for all patients. At the end of the day, we all want the best for our patients. So I'm always looking for more innovative solutions and systems where I can enhance my practice, my care for the benefit of patients. So we're going to be going on for maybe half an hour, 45 minutes or so. Do leave your questions in the chat box, and there will be plenty of time at the end of it to answer any questions. So I'll be going through the dental monitoring side of things today. I do pretty much have a whole workflow of the whole virtual practice system, but in today's webinar, I'm really going to be focusing on how I actually monitor my patients who are actually having orthodontic treatment and are already undergoing it, how I can really monitor them well and really increase my efficiency and accuracy of treatments. Right, so to begin with, what actually is dental monitoring? Now, I'm going to play a short video. It's from Dental Monitoring themselves, just to give a rundown of what it exactly is. And then throughout the webinar, I'll be breaking things down a lot more further.
All around the world, patients are looking for safe and innovative ways to connect with their dental professional. Dental monitoring is behind the AI technology, making it all possible. Thanks to our remote dentistry solutions, patients now have access to their dental professionals whenever they need it, providing convenience, flexibility, and peace of mind. With our easy-to-complete scanning process and our DM scan box, treatment appointments can take place at any time, anywhere. And with inherent features like one-to-one messaging, photos, and video chat, dental monitoring is keeping patients and dental professionals connected remotely. Ready to start?
I'll be going through step by step exactly what the product actually is and how the systems actually work behind the scenes, but then also on the dentist level, team level, but then also on the patient level as well. So for the agenda today, we'll be going through dental monitoring. It's the AI artificial powered remote monitoring. How exactly does it work? We'll be going through how do I customize my monitoring with every patient being bespoke and every dentist having their own protocols. You can really be very hands-on and how you customize your own monitoring protocols here. What does the new patient journey with dental monitoring look like? And then finally, the rewards for yourself, for your practice, and ultimately for patients. So dental monitoring AI-powered dentistry. Now, how does it work? So firstly, as you saw on that video, Firstly, what exactly is the dental monitoring itself? So dental monitoring is an AI-driven app which looks at a multitude of pictures which are taken by the patient themselves, and they are all monitored and it's gone through all the imaging processes. But essentially, to gain the pictures first, this is what we need to begin with. So as you can see the picture on the right, we have a scan box itself, and then we have a smartphone. So how does it work in real life with your patients? So all you need is a scan box itself, a pair of cheek retractors, very, very simple to input, and then a smartphone. Everyone's got a smartphone these days, so only thing you need to give the patients here is a scan box and cheek retractors. So what does it actually do once the images are taken? So what the AI will do is once the images are taken from the patient, it will automatically crop the images for you. It will also label them, and then it would process information. Now, this is really where the AI gets really in depth here and can really give you great value and information from the patient at that current time in real-time monitoring. So as an example, this is what you'll see as a raw image. And obviously with the cropping, you don't want to be seeing the nose or the chins. You just want to be focusing on the oral cavity. So it makes it a lot more efficient here. This is all automated itself. Next is teeth detection. So when the images actually come through the app via the cheek retractors and the scan box, this is the type of quality images that you can really get here. Especially with the Samsungs and the iPhones out there now, you can really get really high quality pictures here. So once the pictures get sent through, they will all go into the AI system to begin with, where they are all labeled, detected, and processed to give yourself more information. So how does that actually work behind the scenes? So when the pictures are taken by the patient themselves, we have teeth detection first off, and then we also have gingival detection. This is just a couple of things that it does measure. And along these two, we can then monitor a whole wide range of clinical situations. Myself, in what I do in my practice and treatment-wise, I exclusively work with orthodontics now and teeth straightening. So I have used a multitude of systems: fixed braces, labial braces, lingual braces, Invisalign and clear aligners. It works well for all systems. Personally, I use Invisalign now, but it is useful for all types of orthodontic systems, as the physics of teeth movement is always going to be the same. So the monitoring is always going to be the same as well. You just need the clinical information to be able to judge what you want to be doing next for the patient here. So the type of things that it can detect is gingivitis. We obviously want clean, healthy gums for efficient teeth movement. So if you ever do see gingivitis here, you can pick it up quickly. That's the real main advantage that I really want to get across on this slide here is any clinical situation that does get picked up, you can pick it up quickly because the patient will be taking their scans themselves. You can make your own protocols on how long you want the patient to scan, which I'll come to in a moment, but you will be seeing them a lot more sooner than you would be in clinic here. So gingivitis can be checked. Any issues or concerns, you can call the patient in as soon as it is detected without having to need to wait for an appointment to come and see yourself. We can see detection of aligner unseating. Now, everyone working with Invisalign now or clear aligners, you know, this is pretty much what we all need to follow here. We must have teeth tracking here. So this is huge efficiency bonus that I've had here in detecting when aligners are unseating and are they seating well, so I can hold back the patient, or I can move them on when I need to, or offer them any more advice as I need to, or bring them in clinic if I do see any unseats. Same thing with attachments. We all spend a lot of time planning our treatment plans with appropriate attachments placed in the appropriate areas. And if one does go missing, you know, it can affect treatment progression. So again, you can pick it up quite quickly and quite fast. Many times patients don't know they've actually broken an attachment many times. So especially if you've really bonded onto it very, very well, they don't even notice if it's been missing. So here the AI can pick up on that. Recession. This is a big one here for all orthodontic treatments here. It's always going to be a risk here, recession, especially when you have patients, for example, with a thin biotype, and you're looking to be very bespoke on the type of treatments that you're trying to set the patient here. For example, when you're looking for, say, space making, you could be thinking about expansion here, or you could be thinking about IPR or distalization or any rotations of teeth to gain space. And when you have a thin biotype and you are using something like expansion, you want to be very, very careful on recession here. So I really focus it really highly on my patient's treatment here, is if I am looking to be moving teeth with expansion and I have any sort of concerns of recession, I want to be keeping a close eye on it very, quickly and weekly, instead of, say, every 6 weeks getting the patient in. Because if you see a patient with recession, say after 6 weeks, then it can be quite difficult to get that back. However, let's say you picked up some areas of recession, on that first week or that second week when the patient's taken that scan, you can then get them back in, pause treatment, retweak your plan, don't make any more expansion movements here, and look at other ways where you can actually make space or relieve crowding here. So this is absolutely massive here on how I can be very, very safe in my patients, especially in this day and age where we're getting a lot more adult orthodontics here. So with adult orthodontics, you do see a lot more recession here than you would in kids. So this is massive and massively huge for me. You can also give great education into patients to highlight where areas of recession may be a bit more risky, so then they can also keep an eye on it as well. And we don't want a shock here in 6-7 weeks time or 8 weeks time when you see a patient for reviews that they're not aware they have recession, and you've got to have the awkward conversation where recession has been implemented now. Again, noticeable unseats, like I showed my upper picture here. So you can see detection of small unseats, and then you can see real bigger unseats as well. Here I've highlighted the upper right two. Everyone working with clear aligners knows the upper right twos, upper left twos are usually the most difficult teeth to move. So it will also pick up on these very, very nicely, and you can use your own type of tips and tricks that you do to move these teeth, but you have information to make a decision now on how you want to proceed here. And as I mentioned, it also works for fixed braces, just like the above image, where if you're missing an attachment, you can also see the same thing as a missing bracket here. And if you have got, for example, a very bespoke bracket that you want to be using, if you want to use a type of lingual bracket, a self-ligating bracket, for example, depending what type of practice you're working in, if you're the owner or if you're an associate and they may not have that particular bracket in, let's say, imagine you saw a patient who had a broken bracket and you don't have that piece of equipment in, you're going to have to order it back in, send the patient away, they have to come back for a second appointment. But just imagine now you can actually get an image of the patient's teeth before they actually came in. So before they even come in, if you need any bespoke material or equipment, you can already pre-order that in and get the patient in sooner to continue the progression of treatment here. So again, it really builds on the efficiency of treatment here by giving you the accuracy of pictures here. So what exactly can it detect? Now, there's quite a lot of reading and writing in this slide here, guys. Now, I'm not expecting you to be going through it or reading it. It is purely here just for reference here. So when you do decide to start implementing dental monitoring for some of your patients, these are just the type of things that the AI can recognize. It will recognize it, but then you will make your own protocols on what you want said to yourself or your team or the patient. You can automate exactly what the AI will do here. This is just what it can recognize. What it will do with the information is it will present it to you, but then you can let the app and the AI know exactly what you want the AI to do with the information to the patient or to you. This will take a little bit of time to set up at the beginning, but just like everything, it takes a little bit of time in the beginning, but then when you see it working, it increases efficiency and workflow, and it gives such a high level of care here where you may miss things with your eyes, for example. Once you've inputted things into the AI will not miss this on the pictures because it'll work on a pixel level, whereas with your eyes, you may miss things here. So this is just some of the things that it can look into where you can set your own protocols up. So what exactly happens then when a scan is actually taken by the patient? So the patient will insert their cheek retractors, their scan box, and they'll open up the app and they'll be automated and notified exactly when to take their scans. Very, very easy to do. Once they take those scans themselves, the AI will then analyze this according to your own customized clinical protocols, which you've already pre-set up from the previous slide to detect any concerns or issues that is picked up and what result or resolution you want from those indications. Once we have the customized clinical protocols, these will then be communicated. They are then automated communications, send instructions to the patient, and then you also get a report and instructions also sent to yourself and also your team. And then you get a back and forth messaging or question with the patient, with yourself or the team. So again, we can close the entire loop here where you are still in control to offer the patient any more added advice that you want to do here. Now, how about some examples? Now, exactly how does the dental monitoring work itself, and what can you actually expect to see here? So this is the dashboard itself of dental monitoring. So when the patient will take the scan themselves, this is what we're looking to see on your dashboard here. So what you can see is the aligner number here, what the patient is wearing, and then you can also see their timeline here of their scans. This is just an example patient that I picked out here. You'll be able to see exactly when they've scanned, what date they've scanned. And if you simply click on these icons here, you can go to that particular scan at that moment in time. And the patient will be getting a green light or a red light, which is highlighted here. And that will also be automated in what is then said or relayed to the dentist and the team and the patient of what you want happening after the patient gets a red light or a green light. Now, for example, here is the 3 example videos of what you would find from the patient itself and what the AI will actually be analyzing. So for example, for my aligner patients, I'll be requesting 3 scans from my patients. I'll be requesting my first scan here. That will be with teeth biting down. So I can check the occlusion with the aligners out. I'll be looking at a second scan here with, again, the aligners out, but here with the mouth open, out of occlusion, so I can assess all teeth like so. And then finally, my third scan here that I'd request is with the aligners in, so I can really assess how the tracking is going as well. There are additional scans, again, if you want to have that, it's completely customizable. This is the bare minimum that would be needed here to have accurate monitoring. And again, if you just look at the quality of the scans here, it's almost as if the patient is actually in your chair. I can see all teeth, I can see all gums, I can see all attachments here. I can really be accurate in exactly how well the aligner is actually sitting here or is not sitting here. Little word of advice here, when we are getting patients to take scans with the aligners, is do ask them to use chewies first, guys, because we don't want any false readings here. The AI can obviously only pick up what the patient will be scanning. So patient education is vital here, which I will touch upon a little bit later. But a little part of it is to just educate the patient to use the chewies before the scan with the aligners, just so you can monitor them more closely and see if there are any tracking issues or not. Now, what will actually happen then? Now, the patient will get a green light or a red light, just like I showed you in my previous dashboard slide, if the patient should be moving on to the next aligners or they shouldn't be moving on to the next aligners. So here we can see I'm very happy with how the aligners are sitting, how they are placed on the teeth, and how they have been tracking. So you can see here, everything is tracking really nicely, and I'm very happy here for the patient to be moving on. The AI here has already automated this to me because I've already inputted as part of my custom protocols that when a complete alignment or non-tracking issues are found and either fully tracking with the aligner seating fully, an automated goal can be given to the patient automatically, and that can also be automatically given to myself and my team, so we are all aware of exactly what's going on here. However, patients don't always get green lights and they will not always go on to the next stage here. So on some stages, a patient will not be ready to move on if the teeth aren't tracking. So what will happen then? They're going to get a no-go. So for example, here, you can see the upper right too, the teeth is non-tracking here. Also, the upper right 3 of my patient is also non-tracking here. Now, this is where we can input in the AI will let you know this tooth is not tracking. Now you have the choice of what to do here. We can keep the patient in the current aligner. We will then be requesting scans in future and moving them on when we are happy. And when we're happy, when the tooth has aligned and tracked nicely. If it does not, we have a couple of options here then. We can get the patient back in clinic. We can go for a refinement. We can add some auxiliary attachments to the tooth or any more clinical treatments which you deem necessary to bring the teeth more to extrusion, but you have access to the data now to make that decision a lot more sooner here in real time. So as an example there, you can see on the upper right too, we have a non-tracking issue. So then what happens as a step 2? So once the pictures have been sent through, the AI has analyzed them. They have given you the feedback if it should be a go or it should be a no-go by the custom protocols that you have already pre-set up. Then step 2 is getting this communication feedback to yourself and to the patient. So you will be seeing this on your dashboard here. This is your original dashboard which I showed you earlier with all your reds and green lights here. You will then have a notification dashboard like so, which will be telling you exactly what the AI has picked up, and it will show you what it has actually done already via your pre-made protocols here. So as an example, we can see here, we have a noticeable unseat picked up on the lower right 5. And if you have a lower right 5 unseat, in my protocols that I've set up, I have had automated a patient message to be a no-go, so they will stay in the current aligners. The patient message will be a noticeable unseat has been detected, and a recommendation will be given to use your chewies and also to improve the aligner wear. A team instruction will also be given to copy this clinical notification into the patient's charts, and the doctor, myself, will also be notified. This has all been preset into the original protocols that are set up. However, if I also deem throughout treatment that I want to say spend a bit more time looking at lower right 5 or spend a bit of extra time looking at upper right 2, I can also tweak the OMA protocols as well. So if anything shows up on that tooth, again, I'll be notified on that. Then we have to communicate this back to the patient itself. So how does the AI now work with your customized protocols that you pre-set up and then send that information to the patient, all automated? But it's not completely automated. You've still inputted the information, but the AI will then send it out on its own accord, saving you time here. And this is, for example, what it would say. As an example, after reviewing your scan, we advise to keep your current aligners in. The fit could be improved. Please remember to use chewies and make sure you're wearing them for 22 hours a day, and we'll see you on your next scan. So this is exactly what the patient will be seeing on their phone. If you want to take it one level up here, where if you get a couple of no-goes and you can see there's an issue here that you can give very instant advice to the patient, you can simply click on the image itself and automate some messages for the patient. So I really love this part of the app, guys. It really gets a great connection with your patients here. Patients are very comfortable using apps nowadays. We have a multitude of apps on the phone. We're getting contacted in loads of different platforms here via emails, WhatsApps, Facebooks, Instagrams, loads of platforms here. So it's a very low friction way to get in contact with the patient here by then sending them very clear, concise messages, but with the aid of pictures here as well. So if you see them on the dashboard here, if you want to be drawing on the picture, you can click on this image here and actually draw on the picture. And then you can also write your message to the patient or whatever information that you want given to them. This is an example video of what I do, for example, for patients on if I want to be a little bit more in depth and educate them on exactly what I'm looking at here. So you can compare this to how I would, for example, do it in clinic. Let's say, for example, you had this patient in clinic and you can see there's a bit of an issue on the upper right too, and there may be an issue on attachment down here. You'll be speaking to about the patient. You'd first do the examination. So you would see this image here. The patient wouldn't see this. You, as the dentist, will see this itself. Then you would have to relay that information back to the patient. So you've seen the visuals, you've done your studies knowing what you need to be saying to the patient, yet when you then put that into language and then communicate that to the patient, they don't have the years of study that you have, and they also don't have the image of the teeth in front of them also to be able to understand to a great level of what is actually going on here. So this is so vital in getting patients really educated on how teeth should be moving and what you're exactly doing here on treatment. So it really engages the patients more, but really shows the patient also you're really being very in-depth there on how you're actually monitoring your patients. So I'm just going to play a video. This is all real time as well, guys, of how you can very easily annotate the images itself. For example, here I may want to look at an attachment, keep an eye on that. I want the patient to know that. You can change your colors of the boxes, squares, however you want. I want the patient here to be, aware that I'm keeping a close eye on the upper right too. You can point arrows in whichever direction you want here. For example, we can see a bit of wear on this attachment. For example, don't worry, keep on wearing your liners. I'm going to be keeping a very close eye on it. And for example, here, I may have a concern about floss. The teeth may not be tracking here. There may be some friction in between the teeth there, which is why it's not tracking. So again, I can highlight to the patient here, this is where I want you to be flossing a bit more. And this is where, for example, I want you to be using a bit more chewies. So you can simply annotate the images here and also write on them as well. Please floss more, or for example, use chewies, or for example, come in and see me if you want to say that as well. So you can annotate the pictures, but you can also do it as text form, as I showed you on the previous slide here. Now, just imagine your patient getting this from the comfort of their own home now. They've got more accuracy. They know exactly what you mean here, and it's all been photo documented as well. So they know exactly what you mean. If they aren't sure, they can have a very quick back and forth with you, and you can also offer more advice, annotations as and when you need to. Once I've sent these out personally, guys, I don't get any negative feedback from this. Patients are completely aware, and they really appreciate the time and effort that I've gone through in actually making this report for them. But in reality, it's actually quicker for me on my end rather than actually been doing it in clinic, but it gives me a much better level of service here and care for patients. So this is really huge here, and it's so user-friendly to use, extremely easy to use this here. So then step 3, we want feedback to the patient, and we want them to also to be viewing their treatment progress. So with the patient taking their own scans, and these are another 2 of my patients here taking their own scans. Now you can actually view their before and after videos. And also you can see what I've written there, not just before and after, but also their before and present videos. So they can keep up with their treatment progress. This is what I have found has also been a game changer for me in the compliance for patients. Everybody wants to see progress in life, not just treatment, but in any sector of life. You always want to be seeing progress. So if you can see progress here in treatment in real time, it will also motivate the patient a lot more to be keeping on wearing the aligners to make sure that they get more green lights and their treatment can be finished a lot more efficiently, and they can see improvements here as well, guys. As an example, this is a before and after video, which is all again on the app itself. The patient can view this. They don't do anything extra here. You don't do anything extra here. This is all inbuilt into the app, and the AI will make this image before and after for you. So this is great. I get a lot of patients loving this, posting on social media, showing friends and family. So it really, not just for me, gets the patient switched on, but it really raises awareness here of what's actually out there. And it also creates a bit of a buzz here in terms of what type of treatments are available to patients. So step 4 is the ongoing direct access communication. As I mentioned before, this is what majority of our phones looks like. Hey guys, we have a multitude of apps. Having one more extra app on dental monitoring is not the end of the world for patients here. It's a very low friction low friction app to get in, especially when it's going to give them such great benefits on their treatment. And this app, unlike all the other apps on this page here, this is bespoke just for that patient. It is just for them, just for their treatment itself. And they have direct access here to their dentist. So with the ongoing communication, if the patient does want to message you, they can simply message you like this. This is just an example. They can pull out their phone, message you directly. Hey, I've lost my aligners. Now you can automate what you want to say back to the patient, advise them how you want to treat them, get them back in, move on to the next aligners, stay in the current aligner, depending on what stage they're on. But again, you can also see exactly what stage they're on by going on to the actual dental monitoring and seeing what treatment progression is ongoing. Now, how do I customize my monitoring? So I've spoken about what monitoring is and how we collect the images and how the AI will process the images. And I also spoke about how you can be very, very bespoke on how you want to be treating your patients and what you want the AI to be looking at. But then most importantly, what you want the AI to be saying to you and saying to the patients. Remember, the AI, it is a great technology, but it will only do what you say. So you must implement what you want it to do. So you are always in control here. So the protocols here, they are the rules of the game, but they are also the rules of your game. With everyone having varying treatment plans, I'm not here to be really discussing on how I want you to be treating your patients. I really want to be discussing here on just opening your minds on how we can be a lot more in depth on how we actually treat our patients. So for example, this is the dashboard that you'll be seeing. You'll be going through this with your reps when you sign up to dental monitoring and how you want to be actually monitoring your patients and what protocols you want to be setting up. So as an example, what I like to do is I like to take regular scans from patients every 7 days. And if they get a green light and a go ahead, they will then be requested for a scan again in another 7 days. However, what happens when they get a no-go? If they get a no-go, I obviously want to be monitoring the patient more closely because they've got a no-go for a reason, given the protocols that you've currently set up, whether it be non-tracking or whether it be attachments being lost. But whether they get a no-go, I then want to be seeing my patient more often. I don't want to be leaving it 7 days. I want to keep a much more closer eye on exactly what's going on here and how I can treat them most efficiently. So I will quicken up my scans after a no-go for a 3-day protocol now. So I will see patient scans every 3 days until I'm happy, and then I'll give the green light to move on to the next aligners. They'll move on, and then we go back to the 7-day protocols here. This is all customizable. Again, guys, again, it goes greatly into aligners, braces, intraoral evaluations. Great level of detail here. You can spend a great amount of time on it, or you can use the protocols already pre-set up, and it really does work really efficiently. And really spend a bit of time here on getting your protocol set up, because once they are set up nicely, then everything else is really swimming, and it really goes so efficiently here. So how do we set them up? So step one, this is what I'll be looking to ask yourselves, and this is what I ask myself here. So when I work with dental monitoring at the very beginning, these are the type of questions that we spoke about on what we wanted to address for my patients. So this is how I could address my protocols here. So it's just showing examples on the side here of the type of things that the AI will be looking into. For example, any aligner damages, any auxiliaries, loss of any bonded attachments, or any tracking issues itself. So the questions that I really asked was, is this information relevant to me? You know, do I want to involve the patient here? Do you want to be involving the patient here? Or do I want to be involving the clinical team? Or do you want to be involving the doctor here? So you are pretty much here telling the AI exactly what to do at what exact stage here. So step two is you want to be now prioritizing your information here. You can give a few different varying levels of priority, either being silent or mild or moderate or severe. For example, if we see here, we see satisfactory aligner tracking. So everything is going well, everything is on point. So for here, the four questions is the information relevant to me? Yes, of course it is. The patient, yes, can be involved. Do I have to involve the team or the doctor? In this stage here, it's a mild involvement here. We know things are tracking. So it's more of a silent notification here that everything is going well and everything is going nicely. However, if we get anything as a lost attachment, or we get a noticeable unseat, where we can really see a big discrepancy in the aligner fit here, or we can see a breakage in the aligner. Now, anything in these areas, is it relevant to me? Of course it is. Do I want to involve the patient? Of course I do. Do I want to be involved in the clinical team? Yes, of course I do, because we may have to get the patient back in now. And do we want to be involved in the doctor and the dentist? Yes, of course. So for anything like a noticeable unseat or any breakages, these will be given an alert for me. So these will give an alert, so we know exactly what we need to be doing. And once we have an alert here, you can then automate exactly what messages you want to be sending through. So step one is asking yourself these questions. Step two is then prioritizing the information on what relevant questions you want to be introducing to the clinical situations here. And then step three is to actually spend a bit of time to actually design your actual protocols yourself. So this is where you can work with the dental monitoring team to really fine tune it and tweak it. And I'm with braces, guys, with orthodontic treatment, all you guys doing out there, you know, it's a very dynamic treatment here. So these protocols, the great beauty of it here is per patient, these are subject to change. If I see some teeth not tracking well, or some movements not going as I want them to go, then I can rejig my protocols throughout treatment very bespokely to that patient themselves. It can be completely hands-on here on how you want the AI to be giving you information here. You really got to think of it here as if you are seeing the patient every single week in clinic, yet you're actually not. You're seeing them remotely, virtually, via very good high quality pictures sent through by the patient. So design the protocols and then also delegate them to your team, delegate them to be also sent to the patient here, and then delegate them to be sent to your own personal inboxes as well. And then we can be automating the process here. So I've got two examples here, two things that have been picked up. Now, if we look on the left-hand side here first, we can see here we have a slight unseat has been, for example, detected. So if a slight unseat is detected, this is how we can set up our protocols here. So what I would be doing here is on a slight unseat, that priority will be an information for me. It's not a warning or it's not an alert. So we would click if the AI ever sees a slight unseat that I wanted to just give me information here. Is there to be any instructions to the team? At this moment, no, the team do not need to be involved. I need to be involved and the patient do. Next, what messages should now be sent to the patient itself? So if it's a very slight unseat, I'm happy for the patient to be moving on. So I'll be giving them a go. And then you can input your messages here and the AI will be giving the patient these messages through. If you want to give a recommendation, you can also then give a recommendation for a slight unseat. For example, I love my patient to be using chewies, so I am always educating my patient to be using chewies. So I will always be giving a recommendation just to keep up the chewy use here. Now, however, what if we have a different scenario where a patient loses an attachment? Now, how do I set up a protocol for that? So on my right image here, if a patient has lost an attachment now, what would I do here? So when you go in to set up your protocols, again, you can do them. Oh, sorry, guys. I've just gone through some slides here. Let me move back. There we go. So this is what you'll be looking at with yourself and also with your dental monitoring rep here on setting your protocols. So if I have a lost attachment here, that's very important for me now. I do not want that to go unnoticed. I want an alert. I want a warning on the ASAP. So that will go to the highest alert level here. So that will be the highest alert level. So what will the AI be doing here once it notices this? The AI is now told an attachment has been lost. It's now been told that I want that to be an alert. Then the AI will be automated to know what to do when an alert is given. A couple of things will be happening here. Instructions to the team, we will be copying the clinical information into the patient chart, and then we'll be calling the patient and scheduling an appointment, and we may need to order a replacement attachment at this current stage. That is all automated to the team here. And then we also give a direct message to the patient that you have a missing attachment. Please get in touch with us for any further instructions or information here. So you can be very, very accurate here on what levels you want to go to. Silent, just information, or a warning or an alert. Just two examples here, guys, that is very, very beneficial, particularly for Invisalign treatment and clear line treatment, but it is just go to show exactly how in-depth you can go here. Now, why is automation so important? Couldn't patients, for example, just send pictures through to me? Wouldn't that just be the same thing? Well, let's compare that now. So compared to self-assessment of photos and compared to the artificial intelligence assessment of this data and photos. So with the self-assessment of photos, one is labor intensive, more time is needed here. And it assumes you to have a very attentive and non-distractive eye and mind here, which can also lead to a very inefficient process here. There will be varying times in the day, guys, where you do your best work. Some people do their best work in the morning. Some people do it in midday. Some people may do it at the end of the day. The point being here is we always have sometimes distracted eyes and mind. It is not always a constant here. However, when you compare that to the AI here, we have added advantages here, such as we can scale really efficiently and effectively here. It is the perfect employee. I love my employees. The AI I just see as an additional employee here. It exactly does what you want it to do when you input what needs to be done on what is brought in by the pictures and the data here. So really see it as an addition to your clinic, addition to your team, and addition to your practice. It really is an extra employee to me here. Many clinical conditions can be monitored here. And really important point here, guys, we have a pixel level assessment here, whereas we may not have the most attentive eyes and mind when we are checking patients, for example, in the chair. Dentists live a very busy lifestyle. In clinic, you may be seeing 4 or 5 patients in the space of an hour. You are not going to be able to pick up everything that you wanted to pick up here. But just imagine you had pictures here, which you can go back to and look into. That is exactly what the remote monitoring will give you, but to an even added level, the AI will also help you here because it will look at the pixel level here. Now, what I mean by the pixel level assessment here is it can look at the images, for example, in between the tooth and the aligner at a pixel level, which is much more accurate than the human eye here, to see exactly how much discrepancy we have here. Or, for example, as I mentioned earlier, the recession. I find that hugely vital here, and we can really pick up on that at a real great pixel level as well if we're seeing any more discrepancies in recession here, for example. It's consistent as well, guys. It's a machine. Machines are consistent. Once they are programmed, they will do what they are told to do. And we can be guaranteed to be timely here. If patients, for example, aren't sending scans through, the AI will already automate them to be sending their scans in. So you don't have to do a lot of chasing here on that side of it. It will also help you on the admin side of things here as well. And the AI, every single day, it will get better and better and better. The more and more images that the AI will receive, the better it will get. This is not just for dental, but this is just in general for AI technology, whether you're looking at facial recognition systems, or you're looking at, for example, self-driving cars, or some of you may have seen this documentary AlphaGo, where they made a machine which would compete, the best, most intellectual players of certain games. Once AI learns particular parts of data and it figures out what is the appropriate solution to it, when you start feeding more data into it, it goes through deep machine learning, which leads to exponential growth there, which is also why you can see a huge exponential growth in other AI technologies which have been coming up. For example, the face recognitions and, for example, the self-driving cars, which we have now. which brings me on to the point of exactly where do I see AI fitting into the dental sector or dental society in the future. So this is a source from the Department of Transportation, and it really focuses on self-driving cars, but it's a very, very good metaphor which we could apply to dentistry and where I think dentistry will fit in the future. So we have varying levels here, starting from 0, where we have no automation, no autonomy. The driver is in charge of everything, or in dental terms, the dentist is in charge of everything in the clinical assessment and examination here. We can go up levels here to 1, where we have some more assistance. To 2, we have more partial automation. 3, we have conditional automation. Here is where the driver is still a necessity, but it's not required to monitor the environment. The driver still must be in control and ready to take over the vehicle at all times with notice. So you still have the hands on the wheel here. If you're looking at level 4, level 5, this is where you're looking at complete self-driving cars, which is what Elon Musk, Tesla, that's where they're headed. I love my AI. I'm all into AI. I drive a Tesla myself, so I can see where the technology is really going here. Dentistry will not obviously go to full automation. I don't think it can get there yet. Maybe proven wrong with technology these days. However, where do I see AI really fitting into dentistry? I see it, around about number 3 here. The dentist is always going to be a necessity here, guys. You will always be in control. The AI would just be an adjunct here, just to give you additional information, but you will always be in control here. Now, how can dental monitoring enhance the orthodontic experience itself? Now, I just want to speak a little bit about a virtual clinic or virtual treatments here. So we can see it such as where the virtual clinic, it leverages the power of digital technologies and AI to break down the barriers of time and space in order to constantly stay connected with your patients, giving them a more convenient and personalized treatment experience. This could not be any more relevant than it really is now. Firstly, in this day and age, we all live in the information boom here, where digital technologies are really skyrocketing here, and where not patients, but people in general, the public, they want things now. They want information. You just get your phone out, you go into Google, you can find information out off the drop of a hat. If you want to be buying a product, you can go into Amazon Prime, you'll get that the next day. Dentistry, I don't think should be any different. This is where the world is going. If patients want information and they want access to their dentist, this is a perfect means for it. You can break barriers of time and space here and really stay connected with your patients to give such a bespoke and greater level of care and assistance to them. You can really be so well connected here. I've really found this has helped my patients so much that the fact that they know that they have access to me, if there's ever been an issue of a patient thinks that something's going wrong with treatment or just has a slight concern, they don't even have to wait for the next scan day. I can, via the app itself, I can actually request an immediate scan from the patient. They can send it to me straight away and I'll get it. And then I can analyze it myself and give them advice pretty much instantaneously. If I need to see them in clinic, of course we'll see them in, but then I'm now already prepared to know exactly what I need to do in clinic once they actually arrive. So it really helps my entire team, my nurses, my practice really set up for that appointment as well and really book it in such an efficient way. Which then brings me on to what's going on now with lockdown and COVID. This is the perfect time for a remote system to be coming out. It's been out for some time. I've been using it since the beginning of last year and before, and it really shot off for me during the first lockdown. Not because it was a change of mindset for myself, but it was really a change of mindset just from society with the Zoom boom now. Patients, there's a lot less friction here to be seeing patients virtually or to be having more Zoom consultations, or just like example right now, last year, I'll be presenting this webinar probably to hundreds of patients live in person, but look at technology now, I'm doing it over Zoom. The same can be made for patient treatment here, especially with orthodontic treatment, where you pre-planned your cases, you know where you want teeth to be moving. You just got to make sure that the patient's wearing the aligners, or if you're using fixed braces, you just got to make sure teeth are moving as you want them to. So this helps me a lot more than it actually helps patients here. It gives patients a better level of care, but it really helps me on my treatments being very, very accurate here and giving the best here. I really want my patients to be the best, my treatments to be the best they can be, and this allows me to do that. So what exactly does the patient journey look like in the virtual era here? Now, I'm just going to touch upon a little bit of how I, kind of navigated through lockdown here. So I really went in on virtual care here, not only to monitor my patients who are currently in pain or were currently having issues. I was doing a lot of remote consultations with them. But then I also built up a very healthy stream of cosmetically driven patients in the now so-called Zoom boom. As we know, a lot of patients are on Zoom now. Many of you now listening to this or watching this, actually not listening, watching, have seen yourselves on Zoom. So I hear this daily on my consultations that patients, they're seeing their own teeth there, and they're actually coming out to clinics now and saying, I've been having a lot more Zoom consultations. I've been seeing the state of my smile. I want to be fixing my smile. So there is a massive boom here in cosmetic dentistry, and this virtual dentistry has really taken off here. And this is where I really see it going in the future. It's not to replace dentistry. It's just an added adjunct, added level of service, which you can input into your practice here. So how did I navigate through it? So this is my website from, I've got my own clinic, that's a separate website, but I wanted to make something a little bit more bespoke, because the main thing that I was finding is just getting patient education across and just getting the system across to patients. Being such a revolutionary system, not many people know about this yet. So I wanted to go a little bit higher and make it a lot more easily digestible for patients to really understand what the process actually involves. So this is just a screenshot from my website. A very, very simple step process for patients to understand. Step one is they'll meet me virtually. All of my patients that I see now, guys, I see them virtually first. The only treatment that I do is orthodontic treatment, Invisalign, and it's all virtual teeth straightening that I do personally. So every single patient that I see now is seen with me for a virtual consultation first. I do that via a AI-driven report, which is generated by a product called SmileMate. It's also made by Dental Monitoring, guys. It is a great, great tool where patients input their own pictures on their smartphone, and then you will get an AI generated report, which you can tweak and customize yourself. And then you can present that to the patient and go through any concerns they have and really work on co-diagnosis here with the patient viewing their own images here. So that's how I start my patient journey. Step two is they'll come and see me face to face. I'll take all the orthodontic assessments that I need. We'll ensure the patient is stable. If they're not dentally stable, they'll obviously go through an oral stabilization period first, and then we'll go ahead to plan the case. Then they'll have their aligners fitted, and then we'll proceed to virtual guidance and virtual monitoring. Here are some of the benefits that I really wanted to input on my particular website here, just to show it's very safe, it's very effective, it's very, very convenient here for patients as well, especially in the COVID age here. I really wanted to get that across. All governments are really encouraging us to really try and keep patients at home. So if my patients can stay home, I want them to be staying home. And if I can still provide a good level of service and treatment for them, that is what I want to be doing here, keeping people safe here, but still providing really effective, accurate, and convenient treatment. So on the start visit, what I would look to do here is when I fit my aligners here is set the patient expectations. You'll reiterate the benefits that I've mentioned here as well today in the webinar. Really educate them on dental monitoring. They must understand the why. Hopefully I've educated why I like to do dental monitoring to you guys here. And I really would like you to bring this onto patients now, because the more you can educate them, the more they'll understand the system, and the more they'll understand how you're going above and beyond the level of care here to be there for them. I'll train them on Scanbox and downloading the app. I'll then encourage the patient to follow the instructions, and then also encourage them to have open communication with me via direct messaging as well. And then I'll be delivering all my aligners to the patient on that appointment, and no future appointments, or if you do deem necessary to set a future recall, you can set that for the patient depending on case by case. But the main thing here is future appointments now are on demand. They are on demand via your remote monitoring scans that you'll be given. So at home, what actually happens to the patient? They will scan as per their protocol. This honestly takes less than a couple of minutes, guys. Very quick, very, very easy for the patient to do. They'll follow the instructions, which you have already inputted yourself. They'll get a go, they'll get a no-go, they'll get Chewy's instructions, hygiene instructions. You can annotate pictures, videos, send that through to the patient, just like I've shown you today. The sky is really the limit here, guys, how much information you want to be giving to the patients. It can really, really be very accurate, very bespoke to each particular treatment here. And then sending messages, any questions or challenges. And then of course, we always want to be celebrating our successes. So whenever a patient does get a go, it is a little bit of a success moment here. So in my messages, I also congratulate patients as well. And you can also automate this as well on a go, just to give a little bit of success here to the patients. Now, in clinic visits, again, as I mentioned, there will be no surprises in the visits because you already know what to expect because you've pre-seen their scans already. They are only needed when necessary, and you can review the chart with the patient. So it also gives the patient an insight in how the treatment is progressing. They have access to the before and after, or as I said, before and present videos as well. But by going through this once more as well with the patient, it just keeps everybody on the same page here and really makes treatment flowing very, very efficiently, really reducing complaints as well, and really improving compliance here. Now, what happens at a refinement as an example? So let's say you've finished your aligners. Now you finished the first stage. You want to get the patient back in for a refinement. Very simple to do. The app has all this inbuilt as well. Simply pause the monitoring, get them in for a scan. As you pause the monitoring, you can send a message to the patient of what you're exactly doing. As an example here, you're doing wonderfully well, you're almost there. Please remain in your current aligners until we wait the delivery of your next aligners. We have you scheduled in on this date, and then we can return to your weekly scans then. In the meantime, enjoy your family vacation. So you can be very, very bespoke and accurate to patients. You have the rapport with your own patients here. You know how to speak to them. You can use your own language to them, but this allows you to do that in a very effective, efficient way. It's very easy to pause and restart treatments here as well from refinements here as well. This has been really useful for me, particularly, for example, during COVID, where some patients, unfortunately, may have picked up COVID. They send me a message to say they don't feel like they want to be wearing the aligners right now. Is it possible that I can pause treatment here? I'll say, not a problem. Your overall health is always going to be my main concern here. So I'll simply pause the updates for notifications. So they're not being bombarded with notifications here. I'd pause the scanning for a couple of weeks, for example, and then they'll jump back into treatment here. So that's been a great value for me here. And patients have really felt that I've really been there for them and caring for them. We're all there for our patients. We all love going to work. We all love caring for our patients. But if they aren't given such messages or given informations, the patient doesn't know that we're actually there for them. So this makes it a very, very low friction way and a very time efficient way to get your message across to patients here. So as an example, a patient journey in the virtual era, how exactly will it work? So for me, initially is a virtual consultation. Then we'll be educating and training the patient on how to actually scan and follow the instructions once they've been fitted with their aligners or fixed braces. We will have weekly checkups here via the dental monitoring app, and only as and when needed in clinic. We can have monthly virtual checkups. So I offer all my patients free access to me on Zoom whenever they want to see me. We can have monthly virtual checkups as and when needed. And then at the end, we can also go into post-treatment retention. I'm not going to go into huge amount of detail on this. It's been quite a long webinar already, but we can also use the dental monitoring and scan box and the AI to still keep an eye on treatment even after treatment has finished. So you can keep an eye on treatment if any relapse has occurred. The last thing we want here, guys, is patients coming back in 6 months' time and saying to you, excuse me, doctor, but my teeth have moved. It's a very awkward conversation to have then if the patient's been wearing their aligners or their retainers, sorry, or if they haven't been wearing the retainers. Here, you can very, very easily be able to monitor them if they have been wearing the retainers or they haven't been wearing them. And you'll also be automated and told how, by millimeters, exactly how teeth have moved. So you can then also educate the patient, excuse me, Mr. Smith, but your teeth are moving slightly. Please wear your retainers more often, or you may be at risk of more relapses. So you picked it up very quickly here, and you've addressed the patient concerns, and you've potentially avoided a complaint here, but you've also just given them just the best level of care you can here to the patients. You've spent a lot of time straightening patients' teeth, and you don't want them to move either. I don't want to be losing sleep at night, not knowing patients aren't wearing their retainers. So I want them to be taking their post-treatment, post-aligner scans just to make sure the retention is actually there. It's more peace of mind for me here. So what are the rewards? I'm just going to go through a few simple rewards of what you can expect here from yourself, for the patient, and for your practice. One major one here is compliance here. Now, compliance, for example, the Hawthorne effect. If you guys don't know what the Hawthorne effect is, the Hawthorne effect, basically in simple terms, is when they behave differently because they know they are being watched. Patients know they are being watched here in terms of how they're wearing their aligners. So they're much more compliant here to be wearing them. It puts more accountability on the patient here. So they are aware that they are part of the treatment here. They must be taking the scans, otherwise treatment will not be working here. They are aware of that by taking these scans here. Accountability is on them. Protocols are bespoke here. You can set them up yourselves. You can change it per patient. You can change it even during treatment for patients. With orthodontic treatment being so dynamic here, this is a great little trick up my sleeve that I can tweak the plan halfway as and when I need to, and really be dynamic in my treatment plans here. Patient experience is also increased because they have more engagement and they have more communication with you and the practice. They feel more wanted, more loved. They feel more cared for here because you're monitoring them more closely. And the results are always greatly improved. They have better cleaning, they have better hygiene because they're seeing their own scans. You can also give education where to brush better, where to floss better. You get better tracking, and across the board, I get much more better quality finishes, which also leads into profitability. Of course, it's going to lead to profitability because it reduces office visits. It also shortens treatment length, and it also shortens the amount of refinements that you may or may not need. And just given the better level of service you can give here and the better level of treatment you can give here as well, you're going to get more patients referred to you as well. So again, you can increase profitability that way also. Now, Bill Gates had a very famous quote here. It's very, very relevant, I believe, here as well. The first rule of any technology used in a business is that automation applied to an efficient operation will magnify the efficiency. And the second is that automation applied to an inefficient operation will simply magnify the inefficiency. In essence, what I'm trying to get across here is automation will improve efficiency across the board. If you're already efficient, it will just magnify it. If you are inefficient, it will just magnify why it is inefficient and why you should be looking into more automated processes to increase time and resources to be spent on particular direct patient care in the dental terms here. Now, what does it all exactly mean here? Now, I'm just going to finish off my presentation by showing you an example of my patient here on how treatment really worked for her. It's about a minute long, but I'm just going to show you from her own words of exactly how remote monitoring helped her.
Cool. So I had braces when I was 15 and I got them when I was about 12, 13, quite early, and I didn't wear my retainers at the end, which was a big mistake. So they weren't as bad as they were, but my teeth didn't move. And I just got a little bit fed up, you know, being in your 30s and not having a perfect smile. And I had a friend who had Invisalign, and she put a picture up and I saw it and I immediately got in touch. I found the Invisalign treatment from the very beginning much simpler than I thought and much quicker. And I think that was strictly down to the scan box, because I was able to not come in every week or two to have my teeth checked. I would just scan them with the box on my phone. I had a pretty easy app to use, and it would immediately send it to the Broadway Dental Clinic, and they could check me every week and move me on to my next aligners without any waiting time in between, which was particularly useful over COVID because we were stuck at home in lockdown, and I would have been unable to get in completely. For 6 months my treatment would have been delayed, but because of the scan box I was able to continue every single week with a new aligner and have my treatment done in the 6 months that we were in lockdown. It's really easy to use. You have your phone, any smartphone, it can be an Android or an iPhone, and you have a scan box. So what you do is you just pop it into the scan box. You can leave your case on if it's a small case. You don't have to take it off if it fits in. So facing the camera in, you place it in and you flip it over. Set the height of your camera at the correct level, because you've got numbers on the inside. And then all you literally do is you open up the app, you put your cheek retractors in, and this clamps onto them, they're all magnetic. And you first press start scan, and then a voice will talk you through exactly what you need to do. You turn it, you lift it up and down, and that's it. It takes a few scans and it's over within 5 minutes. Really happy, much better. I'm smiling more in pictures. Everyone has noticed it. Like, I disappeared completely over lockdown. When I came out, everyone said I had a completely different smile. So yeah, it's been great.
Brilliant. So that's what it's really all about, guys, is all for the patient here. So I've talked a bit behind the scenes of how dental monitoring works, how you can implement on protocols, and that's exactly what it is for. It's really for that last video there. It all culminates into that. It's so easy to use. It's so easy for patients to use here. And it really has helped so many of my patients here. And I really believe that the society is ready for this now, especially with lockdowns happening with COVID. There's a lot more less friction here. So this QR code here, guys, this is a little bit of AI during the webinar right now as well. If you do want any more information here, if you just grab your smartphones out here and just put it on camera, and if you just put your, I'm gonna leave this up for about 30 seconds or so, so you can get your phones out and just put your phone camera onto it, and you should get a link up there. It should take you into a page, something called SmileMate. SmileMate, as I mentioned, that is another system product. It's from Dental Monitoring, same company. That is what I use to initiate my virtual consultations itself. That is a topic for a completely another webinar, but that is how I use my, that's the system that I use to get consultations in. If you want to be speaking particularly about dental monitoring and Scanbox itself, it's the same QR code here, guys. Just fill your details out, but just mention to your rep, someone will get back in touch with you that you want to be talking about SmileMate or you want to be talking about dental monitoring. It's the same code here. I just finally want to finish off on my last slide here. I'll leave the QR code up there for anyone that missed the previous slide. But I really want to just touch base on just the 4 stages of, learning, or the 4 stages of competency here. So I don't want this to be thought of as something that I can't do. I work in a, standard practice, a rundown practice. My practice isn't advanced or innovative enough. I'm an associate. I can't do this in my own time. You can do this, guys. I was an associate. I built up a whole new list during lockdown, which was built purely on virtual systems here. So I built an entire orthodontic list just from my virtual systems here. So it is a learning curve, but as with all levels of learning and stages, you will go through these levels here. Some of you may be just aware of this right now. So you may be at the stage of unconscious incompetence, where you're just not aware of what a problem actually is. But the first thing you'll notice then is becoming consciously incompetent. So you're consciously aware now of a gap in your learning or a skill that you want to be learning into. Hopefully this webinar has opened up your eyes. So hopefully a lot of you are now in this conscious incompetent stage. And I'll be hoping that a lot of you are going to be learning your trade, really honing your skills, setting up your protocols, learning dental monitoring, learning virtual systems. So you can then get into the next stage here, which is conscious competence. And once you truly get really efficient at it, you'll know this like the back of your hand. That's the level of an expert here, where you can really become unconscious competent. But don't get complacent. I do never want to get complacent. So I'm always searching for mastery here. So I'm always going to be improving on my own current systems here to try and keep on learning here. Hope I've given enough value here, guys. And I hope you can see how we can work together with the AI here to help ourselves and to help our patients. And again, the QR code just on the side there. And Dental Monitoring have been very, very kind from hosting this webinar, that they are also offering a free 1-month SmileMate trial. So get that on the QR code there, fill out your details, and one of the team from Dental Monitoring will get in touch with you. But for now, I want to open the floor to any queries, questions that you guys might have about anything that I've discussed today. I'll leave the floor open.
Thank you. Thank you for that, Emma. That was brilliant. Absolutely love that presentation, and that testimonial from the patient at the end was just absolutely fantastic. She was thrilled. I love that she disappeared for a few months and came back with
Yeah, she had a great experience. So she was, all of her friends and family, she still says that now, that she came out like a brand new smile now. And we're still in lockdown now, so patients are like gonna experience that again now. My current set of patients now that are gonna come out of this are also just gonna have a beautiful smile when they come out from it. So one thing that I found that patients always say to me is they should have done it sooner.
Yeah.
So got it sooner, they've got this smile sooner as well.
We have had a few questions, so I'm just going to put a few questions to you that have come through. How are your team finding this, and have you had any pushback from your team?
So like with anything that's innovative, guys, there's always going to be some sort of pushback here. So I can answer this in two kinds here. One, was obviously patient pushback, and the second was obviously team pushback. There's always going to be team pushback on any new system that you put out there. But as long as you make your team aware of why you're doing this and what your actual intention is. The intention here is to give an extra level of service for the patient here, but it also improves efficiency for my team. So with the reduced number of appointments here, and also with the AI to be able to automate what clinical instructions you want to be giving to your own team, they can actually do their work a lot more quicker and a lot more efficiently. And then when they do have more time free, then they can spend that time on more important tasks, which are at the patient in hand here. So it does take a little bit of team buy-in, but you just got to really explain and take some time to explain here that this is for the benefit of everyone here, not just the patient, but also the practice here. And that's the same thing that I'll be saying to patients as well, that I can be in touch with you more. I can keep an eye on treatment a lot more. So it's really about education here. So I'm very glad you asked that question. If there's one thing that I could get across from the presentation today, it is to get across to know how AI can help you, but then truly how you can educate your team and educate patients here to be more accustomed to this type of system and treatment here. AI is everywhere around the world. So if you just make it a bit more relevant to your team, they'll understand that this isn't something new. They deal with this in every day of life here. On iPhones here, the facial recognition, that's all AI driven here. So everyone has this in every part of their daily life. So this is nothing different here. And it's pretty much just getting that message across to my team and patients that the technology is already here and it's for the benefit of everybody else. And it just takes a bit of a mindset shift here. So we're still in the early innovation stage here. So everyone on this webinar here, very, very proud of everyone joining in, because you're still on that upward curve. Everyone here is still an early innovator here. So you're really going to reap the best rewards of this when this becomes a lot more mainstream in the future.
Thank you for that. That's a really good answer. Another question that's come through is, do you charge extra for dental monitoring with your patients? Me
personally, I don't, because it helps me a lot more here. If you're looking at it from a profit point of view, you're looking for a patient care point of view, I like to look at it from like a whole point of view. I increase my patient care here by giving dental monitoring to all my patients. I spend a lot of time on my patients on how to plan the case, especially with Invisalign. With my further studies, I can really plan really accurately how I want teeth to be moving. As long as the patient wears the aligners, teeth will move nicely. So it's an added benefit for me here. So I don't have a massive concern about an additional cost here. Even if I was, for example, to include an additional cost here for the remote monitoring or for the scan box, it kind of pays for itself already, because the fact that I have less in-clinic appointments here, I have my chair free where I can get another patient who's in need of treatment here in that chair. So it reduces surgery time here. So if you charge for it, that's your business decision. If you want to charge for it, personally, I wouldn't, because it actually helps you a lot more than it does the patient. And you're going to get the returns here because of the amount of time you're going to be saving here. And on top of that, you're going to get more referrals. So to me, it pays for itself. Yeah. Easily pays for itself.
Yeah, that's great. And then we have another question. It says, thanks for the really informative webinar. There you go. It seems that you've got a wealth of knowledge of AI behind you, and it seems evident that DM has really helped your workflow and managing your patients. I imagine the majority of patients have welcomed DM, but how do you deal with patients who exercise some reluctancy to DM or do not want to adhere to it? Have you made DM compulsory?
I give DM to everyone. They have the option. If they want to see me in clinic, they can see me in clinic. This benefits me here more. I know what treatments that I want to give my patients. I always want to be going above and beyond the level of care for my patients. I do not want to be seeing my patient after 6 weeks and seeing how teeth have moved and me not knowing what's going on for 6 weeks here. So if the patient does still want to come to the in-clinic appointments, yes, great. You can see me every month. Yes, great. I love to see you. I love my patients, but I am still going to give them dental monitoring. So I give them all dental monitoring. I educate them on dental monitoring. If some patients don't routinely take their scans, again, there are messages here, the notifications that go through to make them aware why they should be taking their scans. And again, it's more patient education here. Let's just say, for example, if a patient is not taking scans, let's just say on average, a treatment will be lasting 12 months for an orthodontic treatment here. So 12 months, 52 weeks here. They're going to be taking 52 scans that I request them to take. Let's just say a patient is late just 1 day per scan. So that means for 52 scans, they're late for 1 day. They are now technically 52 days late in treatment. Their treatment has now increased by about 2 months here. Wording it like this to patients kind of gets them to understand why they should be taking the scans, because it's in their benefit here. It's going to reduce treatment time for them. They can go out and have laugh and a joke and a smile in a shorter amount of time if they do take their scans. So simple answer, I do make it compulsory to patients. Is it compulsory for them to use? The choice is always theirs. Treatment is always their choice, but it is compulsory for me to give it out at least to the best of my ability to educate the patient here.
Yeah. Okay, that's great. We have a question. We've got a couple of questions about IPR actually. How can you check if the patient has got adequate space for movement and whether you need to do more IPR? I think that's mean like how do you check on the scan if there's any sort of binding contacts, or how can you check?
So here, what we can do, so with the way I like to plan my IPR is, given I've done quite a lot of Invisalign cases, so I tweak my plans to try and do all my IPR in say stage 1 as I fit the aligner, or if there is some IPR to be inputted, say throughout treatment. For example, I only want to be doing IPR when your teeth are in nice contact here. So I'd wait for that contact to happen, and then I'd try and input all my IPR in that same stage, just to avoid patients coming in. So that's one side of it. Now, when I make all my IPR, again, I think the question was, how do I ensure enough IPR has been done here? That's something that's obviously going to be done in clinic here. So that's a clinical question here. When they are in clinic, you should be doing IPR with your IPR burrs, your strips, however you deem necessary to do your own IPR, but then check that with the IPR gauge. So all my IPR is always checked on with my IPR gauge, so I know exactly how much is done, and I make sure all that IPR is done before that stage, and I can obviously check it with my IPR gauge. So you can do it throughout treatment if you wish, if you like doing treatment like that. The way I like to do it is, let's say, for example, I've got some IPR set to do at stage 10. I know I have to do that before stage number 9. So I will input my protocol where the app AI will actually automatically let me know that the patient has got onto line number 9. So I know I must be doing IPR now before number 10. So I get the automated message myself. That then goes to the team. The team books the patient in for IPR. Then I get them in from IPR, do my IPRs. I have to check it with my gauge. Then they go back into scanning. So that's how I check the IPR has been done. It's always in clinic here, the IPR, and it's checked with a gauge clinically. And then they go back onto monitoring afterward.
Okay, that's great. That's really good. And another question is, have you seen a difference in the compliance with your patients wearing their aligners?
Yeah, massively, guys. Hugely compliant. It goes back onto the Hawthorne effect, where people's behavior changes when they're actually being watched. So they know that I'm watching them, so their compliance is a lot more greater. If they don't take their scan, the patient will get a nudge, will get a notification to take their scan. So they know that I'm always there. If they miss, 2, 3, 4 scans in a row, then again, I've set up my protocol to send me more of a deeper alert on that. And that's when I'll be, my team or me personally, I'll personally call the patient up to see what's going on, because it may just be an issue on their end. Life gets in the way, guys. I'm completely aware of that. So it just offers you just an open opportunity to just talk to the patient. So some patients, do have some compliance issues, but this helps you on that. If they're going to have compliance issues on taking scans, just imagine how many compliance issues they're going to be having on just wearing the aligners if you don't give them the scan box themselves. So
yeah, you go
hand in
hand with compliance. Yeah,
exactly.
yeah. And it says, you mentioned that protocols took a long time to sort. How easy is this for you to do?
It's very simple, guys. When I said a long time, I don't mean it takes days, okay? I mean, it takes maybe like a Zoom call with Julie or one of your reps, okay, to get set up. I guess, Julie, you can answer that better than me. How long does it take you to set up protocols for your dentists?
Yeah, so it doesn't actually take that long at all. We just ask you a series of questions so that we can input into the protocols and reflect exactly how you practice and the decisions that you would make if you had that patient in the chair. Then we allow it to input those decisions into the protocol. It usually takes about an hour, but actually all the hard work is done by the DM team, and there's no hard work needed really from the dentist side at all. Okay. I think a little bit off topic, one question: would you recommend the clear aligner diploma?
Yes, I would. I've done quite a lot of orthodontics in my time. As soon as I graduated at university, so I did a lot of orthodontic courses. I've gone to the wide orthodontics course taught by special orthodontist Dr. Ian Hutchinson. He taught me labial braces, fixed braces, lingual braces. The postgraduate diploma in clear aligner therapy, that's run by Dr. Raman Orlak and also Dr. Andy Toy. Yeah, I would recommend it. It's really improved my game here in clear aligners here. It comes through courses and experience here as well. So I would advocate every course, guys. I'm always an advocate for self-learning here. Self-investment is the best investment. If you're particularly looking to get a course for clear aligners, you really want to take it to a higher level, then yes, I do highly recommend that course.
Okay. And this isn't really a question, it's a statement, but it's very nice. Seems like an amazing feature. I think it's about time the world of dentistry incorporated AI. Thank you for sharing your knowledge on the system and raising awareness. The future of dentistry is here. I couldn't agree more. The future of dentistry is here and it's so exciting. Thank you very much, Dr. Sohal. It's been a really, really good webinar. And for everybody who is watching, please feel free to reach out to the team, scan the QR code on the screen or go onto our website and contact us, and somebody will be in contact with you soon. Okay, well, thank you very much, everyone, and have a nice rest of your Sunday evening. Thank you.
See ya.
Bye-bye. Bye.